Imagine that you are having a medical procedure, anything from getting your teeth cleaned to having a colonoscopy.
Your anxiety, like many other folks, is probably high and rising as the moments pass.
Doctors can lower your anxiety with prescription medicine, but that might have some side effects.
Your anxiety is probably rising, and that anxiety can impact your pain and your recovery.
Are there other ways that successfully lower anxiety and have no side effects? That's the question that we wanted to answer in our 5-year-long research project. And the answer, fortunately, is yes.
One of our jobs as a clinical psychologist sometimes involves consultation with other healthcare professionals and understanding the literature, particularly this literature, on different approaches to manage patient anxiety.
Wouldn't it be a great idea if we could pull together all of this research into one set of articles so that everybody could go to one place and find out, what are people doing to address patient anxiety in all these different areas? And that's where we got the idea to do this massive literature review.
The team is so great and everyone was very motivated and everyone was very committed to the project. And so being part of something like that was really exciting to me.
We know that anxiety is very intertwined within the body because anxiety causes that physiological response, that fight or flight response, right? And we know that by helping people relax, that you can't have two competing demands. You can't have a relaxation demand and an anxiety demand going on inside your body at the same time.
Dentists and dental hygienists have been thinking about these issues for more than 50 years. And in a sense, doctors and nurses and other healthcare specialists are just sort of catching up in understanding how important these issues are. We had to cast a very wide net and look at every possible article that would have meaningful research to include. And we'd have to go back as far as the articles took us. It turned out to be 1974. It was a dental article on addressing dental phobia. We knew we were going to need a lot of help with this. And so Jill identified one of her colleagues, Jen, from the dental school library, and another colleague, Arthur, from Macaulay School of Nursing here at Detroit Mercy. I identified a physical therapist from outside the university and one of her graduate students. And then I put out the word in our clinical psychology Ph.D. program. And Brandy came forward and said she wanted to do this research, as did Reem and another student, Erica. So it turned out to be 9 of us.
We looked through all of the articles and came up with all of the categories. And we came up with 15 categories. So those were included things like music, relaxation, hypnosis, massage, education, acupuncture, social support, and a few others, and determining where each article fits in so that when it's time for us to write, we can go through the articles that are relevant to that particular area.
While I felt prepared to do research in that arena, I think the systematic lit review was definitely something different.
Jill and Jen, the 2 librarians, were really experts in doing online literature searches. And so they created a massive search string. I think in the end it had like 55 terms so that we would catch as many. We wanted to find everything that was out there in English, no matter what country the research had been done in. The initial step was, yes, each abstract had to be read twice. So 2 of us had to read, that's 96,000, abstracts that had to be read. And then we had to keep, because it was systematic, we had to keep track of why we were rejecting every single article we rejected. Maybe it was because there wasn't a control group, or maybe it was because the sample size didn't have at least 15 people in each group. Or maybe they didn't have a valid measure of anxiety, but we had to keep track of every single reason why we rejected an article. And you have to have really good records on all of this, or the article's never going to get published. We had to evaluate all of those things on a score sheet. And then if we decided the article was of sufficiently good quality, then we recorded, okay, this was an article on, say, labor and delivery, reducing the patient's anxiety by means of perhaps massage. Was it effective or not? we had to enter a yes or no, and then additional notes about who provided the massage, who trained the person. And all of that had to be recorded. And then once all that was done, we had to go back, interpret the patterns, and write the 2 journal articles that got published. That's why it took 5 years.
I knew that I would stand to learn quite a bit, and I did, around how to do this kind of research, which isn't, because of how long it is, it's not something that I thought I would be able to do as much perhaps down the line in a 1-year internship, for example. So the fact that it was a time commitment, I knew that I would stand to learn a lot from it.
We know that Tylenol works for headaches, right? But what's the best dosage and duration between dosage? It's the same thing with managing anxiety and using these different interventions. We know, say for instance, that the music intervention, that works. But what's the best way to implement that music intervention? Is it using headphones? Is it letting the patient decide what type of music?
Does the genre matter? And yes, it does seem to. Usually that turns out to be classical music, whether it's Western classical or Turkish classical or Chinese classical. We were reading articles from all over the world. And so in China, Chinese classical music was often the choice for helping patients be more relaxed. Some of the most creative pieces of research that I read had been done in Turkey and Iran and Taiwan. And it was so interesting to see that people all over the world are really interested in this important question of helping patients be more comfortable for medical procedures. And so, for example, to read about Turkish researchers using acupuncture and acupressure to help patients relax before surgery was just so interesting, so impressive that they were doing, such good research.
What I love most about this project is being able to share with the medical field and dental field that these are very accessible ways and cost-effective ways to reduce patient anxiety, and the fact that anxiety reduction has such an impact on patient recovery and experience of pain is really quite fascinating. I think a very impactful finding.
As healthcare professionals, we do want to make sure there is a fine balance in empowering our patients with knowledge and assuring that it's not too much information to where they feel overwhelmed. And that is definitely a delicate balance as well, because part of that anxiety response is feeling trapped and feeling like we don't have power to change our circumstances. And that is why that, patient education finding probably, materialized, is because when we have too much information, we're on brain overload. For one, we don't know how to process all of it, and then we're stuck because we have to get this procedure maybe for our own health. And we become anxious because we feel powerless. And so doing these interventions that can, help patients feel empowered, such as the cognitive behavior therapy, which is a mixture of that education, relaxation, different behavioral responses, or, the music, giving them the power to choose the music, is even something so small that we can give someone a sense of control.
As we moved along and we realized that we had some really valuable information, Jill and Jen and Arthur started thinking about what sorts of journals we might want to approach. And we thought, well, should it be a nursing journal? Should it be a dental journal? And then we thought, no, it probably should be maybe a journal that looks at alternative and complementary medical approaches that people from all different sorts of medical fields might be interested in. And so I contacted the editor of the Journal of Alternative and Complementary Medicine. And that was so gratifying because as soon as I emailed him, he emailed back and he said, "We're interested." And as we worked it through with the editor, we realized we really had 2 articles. One was the systematic literature review itself that just summarized, okay, how many experiments in surgery have been done, how successful were they, how many have been done in, say, mechanical ventilation, how successful were they, and then a second article that goes into why. why does music work pretty well in surgery, but not well at all for colonoscopy? Actually, nothing works very well for colonoscopy. So, I mean, that was an interesting point that we ended up making, that that's an area, a medical specialty that really needs to do, it would benefit from more research and lowering patient anxiety. But we found the Journal of Alternative and Complementary Medicine to be very good to work with. And in the end, they published both of our articles in 2021.
Finally being able to say, oh, all this hard work between team members, not only doing the research itself, but the writing of the manuscript, the correction of the feedback from the reviewers, and still having the energy to submit that is just an incredible thing to see come to fruition.
It felt really exciting, and it felt very rewarding to have been part of something so big and so impactful.